Hey guys, if you haven't heard about Anchor, it's the easiest way to make a podcast. Let me explain. First off, it's free. Secondly, there's creation tools that allow you to record and edit your podcast right from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcast, and so many more. You can make money from your podcast with no minimal listenership. It's everything you need in a podcast in one place. I absolutely love it. So make sure you download the free Anchor app or go to Anchor, ANCHOR.FM to get started. Hey guys, welcome back to Baby Bump Life. This is Nurse Wit here, and I want to talk to you guys about what you can expect at the hospital with COVID-19 going on right now. I think this is a very scary time for everybody, and a lot of moms aren't getting the childbirth education and breastfeeding information and baby basics information and infant CPR information. Especially for first-time moms and dads, they're not getting all of that information that they need. And if this is their first baby, this can be a really scary time. So do check out online resources. As you all may know by now, if you've listened to my other podcasts, I do have a YouTube channel, which does have free education. If you go to my playlists, I have a labor and delivery playlist, breastfeeding, I even have a postpartum, how to prepare for baby. So check out those videos. That should help as far as some free education goes, so that you aren't going into the hospital completely blindsided on what to expect. But I also want to talk to you guys about what to expect at the hospital with the whole COVID-19 thing going on, because things are just a little bit different, obviously. So I'm going to talk to you in general about what some of the hospitals are doing. And of course, this is different from area to area and hospital to hospital. But I do recommend that you call the hospital you're planning on delivering at to see what restrictions or rules they have at this time. That way you're not caught off guard when you get there and, they tell you, oh, you can't do this or that. And that way you're just updated. So most of the hospitals are limiting visitors if they're even allowing them at all. So typically, it depends on the hospital. Some are not letting any visitor. You have to go in by yourself, which I know is so hard and so crazy and nothing that anybody would ever think would happen. That can be very scary, but know that your labor nurses are there for you. This is a scary time for us too. And, as a professional, this is something that, we've been taught and we do. We're there for you. We're there to support you. We are the patient advocate. And I don't know many nurses out there that aren't willing to help a mom, and especially in times like this. So if you do happen to go into a situation where you do have to go by yourself, just know that there is staff that's going to be able to help you. But some places are still allowing one visitor, so the dad or support person. And when you do get there, they are, most places, again, requiring that mom and the support person are wearing masks. And usually they give you those when you get there. And they're asking that you wear those when you're in the hallways, or if you're in your room, when staff is coming in, you put your mask on. So usually it's okay if you take your mask off, when the staff is not present in the room. But when they come in, they ask that you put the mask on, because as you know, just the regular surgical masks or a cloth mask if you're wearing, because not everyone has availability to the N95s. So if you're just wearing a regular mask, that is only protecting you from spreading it. So for instance, if I'm wearing a mask, and my patient is not, my patient's protected because I cannot, I'm not going to be passing it to them, but I'm not protected because the patient's not wearing a mask. So it is just ask that you do that you wear a mask when the staff are present, especially just because, we are going home to our families too. And labor and delivery, you are just all up in the mom's face when she's getting that epidural, helping her to bend over and hold still and when pushing. And so we do ask that you do try and keep that mask on for us. I know it's uncomfortable and I know it's not fun, and I certainly don't like wearing it for 12 hours, but unfortunately that is the time that we're in right now. So that is what a lot of places are asking as far as the masks go. Many places are limiting the entrances into the building, so just make sure, again, it would be a good idea to call ahead of time so that you know what entrance to go into, especially at nighttime. They may be blocking and only have one entrance into the hospital, so make sure you know where to go. They are also limiting the number of times typically that your support person can go in and out of the hospital, just to decrease that movement and flow of potentially passing the virus around. So make sure that if you're coming up in labor, your water broke or whatever it may be, bring all your stuff up with you, so that dad or support person doesn't have to go back down to the car and get it all. And then lastly, when you are thinking of going home afterwards and thinking about having family over, just be very, very cautious. And I would even recommend talking to your pediatrician about that too, because most places, or most pediatricians, are not recommending that anyone comes over. I had Hugo during flu season, and I was very cautious about who was allowed to come into my house in the first month, and that was just flu season, and these babies just have tiny immune systems, and so this is just a virus that we aren't too sure about right now, so we just need to be very, very careful with that. Also, with that being said, with this virus that we aren't very sure about, I know a lot of moms have thought about doing placenta encapsulation. And I actually had a mom recently who had asked me about that, and my thoughts kind of are, we're not sure about this virus. Not everybody's getting tested. What if, God forbid, you were a carrier of it and didn't know, and you started, encapsulating and eating your placenta, and maybe that passed on to baby later on, and maybe the infections could spread that way. I don't know 100% that that's positive. I'm not for sure, but I'm just thinking there's so much unknown about this. Why risk that chance? Especially when, there's no FDA approved way of doing the encapsulation, and it's not something that the CDC is recommending. So, we're following CDC guidelines on what coronavirus is, what they're recommending with the coronavirus and wearing masks. So I just wanted to throw that in as well, as far as the placenta goes and what you should kind of follow with that. And then one more kind of thing that I guess kind of goes along with that, with the virus and everything, would be with cord blood banking. I personally, we did cord blood banking with Hugo, and we used CryoCell. I absolutely love CryoCell. I think it's a fantastic company, and they're actually looking at the coronavirus, COVID-19, and cord blood, their stem cells, and doing research, and I think that's fantastic, and just kind of looking at what can be done, and maybe trying to help save a life that way. So lots of new things are going to come about from this, and I just wanted to share those couple things with you guys. If you have any questions regarding, any of the things I mentioned there, please let me know. And if you do have any questions about the cord blood banking with CryoCell, please feel free to reach out to me. I do have a little link that I can email to you and give you a little discount code too if you are interested. So I hope that helps you guys. And if you are looking, just to mention, to contact me, you can reach me at babybumplife@gmail.com. I do try to respond as quickly as I can to emails, so don't hesitate to ask me anything. All right, guys, thank you so much for listening. I will talk to you guys all very, very soon. Stay safe, wash your hands, and I'll talk to you later. Bye, guys.